Hi, thank you for watching Digging to China. I'm Dong Xiong. If you have not done so already, please subscribe to my channel. Thank you very much. The global community's recent widespread attention and discussion on a societal issue in China are prompting questions about another development in the country. This time, it doesn't involve real estate, local debt, or a financial crisis. Instead, the World Health Organization has unexpectedly reached out to Beijing, seeking clarification on what infectious disease the Chinese Communist Party is addressing. The request is for a swift release of the original data. The Wall Street Journal initially reported on this development, and other media outlets have followed suit with their coverage. This development has sparked global apprehension, just as the world was recovering from the widespread devastation caused by the global COVID-19 pandemic, originating from the novel coronavirus linked to the Chinese Communist Party. The World Health Organization is once again raising concerns, urging the CCP to disclose the current situation. This has sent shockwaves across the world. In recent days, global attention has turned to a developing situation in China. A new outbreak of mycoplasma pneumonia has emerged, causing widespread infections in several Chinese cities. Hospitals, particularly in Beijing and Tianjin, have been overwhelmed with patients since November. This resurgence of infectious cases has reignited global fears, reminiscent of the initial days of the COVID-19 pandemic. The international community started noticing this new wave of infectious diseases around August, as cities like Beijing, Shanghai, Yunnan, and Guangzhou reported significant outbreaks of mycoplasma pneumonia. The strain on medical facilities has been evident across various departments, from pediatrics and emergency units to fever clinics and infusion rooms. The prevalence of mycoplasma pneumonia usually peaks in August and September, but this year's situation is notably severe. In Zhejiang province, the number of mycoplasma infections in children has surged to 18 times higher than the same period last year, indicating a particularly alarming rise. According to data from the Shanghai Children's Medical Center, cases have doubled compared to previous years. While mycoplasma pneumonia continues to cause widespread impact across various regions of China, reports have also surfaced about other infectious diseases including influenza A, the novel coronavirus, and some unidentified infections occurring throughout the country. Since November, various regions in China including Guangdong, Jiangsu, Yunnan, Fuzhou, Chongqing have seen health departments issuing warnings about the prevalence of mixed respiratory infections. The pathogens involved in these cases encompass pneumonia, mycoplasma, influenza virus, novel coronavirus, adenovirus, and common bacteria. The symptoms associated with mixed infections include coughing, phlegm, runny nose, fever, lung infections, general fatigue, among others. Medical professionals emphasize that the risk of mixed infections tends to be higher in younger individuals. Additionally, if adenovirus and streptococcus pneumonia coincided with mycoplasma infection, the severity of symptoms may escalate. The concurrent impact of multiple viruses has exacerbated the strain on hospitals, clinics, and emergency rooms across the country. Major healthcare institutions like Beijing Friendship Hospital have posted notices indicating emergency waiting times exceeding 24 hours, underscoring the challenges faced by emergency services. During Reuters' visit to Beijing, they observed a surge in patients at Beijing Children's Hospital, with long queues extending to the entrance gate. Some people even brought camping chairs as they waited outside. Apart from the overwhelming numbers of patients, many children diagnosed with respiratory diseases are facing severe lung complications, including pulmonary tearing and lung expansion. The necessity for lung washing adds an additional layer of concerns to the situation. The Beijing Municipal Health Commission has stated that the mycoplasma pneumonia virus may have undergone genetic mutations, exhibiting some resistance to azithromycin, the preferred antibiotic for children with mycoplasma pneumonia. This resistance increases the risk of causing lung infections. In response to the outbreak, many people on Beijing's busy subway have voluntarily started wearing masks. To prevent cross-infections among students, cities such as Beijing, Tianjin, Harbin, Suzhou, and Jilin have announced the suspension of classes in schools within their provinces or municipalities. There is also a phenomenon of panic buying of the antibiotic azithromycin. However, officials have now advising against such purchases, emphasizing that this antibiotic is ineffective against viruses and can only address inflammation. This wave of infectious disease has caused anxiety among the Chinese population and left the international community puzzled. Here are my takeaways. Firstly, over the past 3 years of the COVID-19 pandemic, a crucial lesson has emerged. Trust in the Chinese Communist Party and the Chinese government has been severely eroded. When the new coronavirus initially emerged, the CCP not only denied its existence, but also detained and coerced whistleblower Li Wenliang, fostering an environment of secrecy and misinformation. The attempt to conceal the truth instilled fear globally. Despite the eventual acknowledgement, the CCP falsely claimed the situation was preventable and controllable, asserting no human-to-human transmission. The subsequent cover-up led to rapid spread of the virus, fueled by events like the Wuhan community organizing a large New Year's banquet. As the situation spiraled out of control, the CCP implemented extreme and inhumane lockdown measures. The memory of the suffering endured by the Chinese people during the COVID-19 pandemic, exacerbated by authoritarian tactics, creates heightened anxiety whenever news of a new outbreak surfaces. The international community is now scrutinizing events in China, reflecting the enduring apprehension from surviving the pandemic. Secondly, the international community's apprehension about the potential developments in China stems from the fact that the Chinese Communist Party has opted not to disclose information about the current situation this year. Contrary to this, the coronavirus hasn't vanished. For instance, the United States is actively reporting cases and implementing preventive measures. However, China's official response has shifted, choosing not to publicly manage the aftermath of the ongoing pandemic. This lack of openness generates an uneasy atmosphere, leaving uncertainties about the actual severity of the situation. In dealing with new viruses or outbreaks, the CCP remains hesitant to address them directly, prompting the World Health Organization to step in and seek clarification about events unfolding in the region. In theory, information about any public health issues in China should first reach the Chinese public, then report it to the World Health Organization. However, the current scenario is the reverse. WHO becomes aware of problems in China and urges them to provide notifications. This highlights the international community's apprehensions regarding China. The Chinese authorities, hesitant to label the winter epidemic as a pandemic, also resist publicizing the state of public health. This reluctance plays a crucial role in intensifying overall anxiety. Thirdly, it's not just the Chinese citizens who harbor distrust towards their government. This sentiment extends to the international community and even the World Health Organization. This creates a peculiar scenario where the Chinese Communist Party seems unaffected by the lack of trust, in contrast to democratic societies where public distrust can significantly impact the government. The CCP appears indifferent to whether people believe in it or not. This nonchalant attitude contributes to heightened concerns both domestically and internationally, underscoring the CCP's unyielding stance. Fourthly, and this is the perspective I want to emphasize, Xi Jinping's governance style represents the most significant threat to public health in China and worldwide. The apprehension about the potential issues in China stems from the lack of information available to the Chinese public, leaving them unaware of any current outbreak and uncertain about the prevailing conditions. The heightened anxiety surrounding public health and the disastrous outcomes of recent public health crises underscores the substantial risks associated with Xi Jinping's leadership style. We can substantiate this conclusion by examining three key aspects. First, in the realm of Xi Jinping's authoritarian leadership, the entire bureaucratic system tends to emphasize positive aspects and avoids acknowledging negatives, whether it's a critical infectious disease or seemingly minor economic issues. Economic analysts are constrained to portray a consistently favorable outlook, overlooking potential downsides. This inclination towards positivity became evident in initial response of local officials in Wuhan during the 2019 outbreak, where the instinct was to conceal information. The root cause lies in Xi Jinping's preference for positive narratives and a reluctance to entertain negative perspectives. This predisposition introduces significant risks to public safety, a situation fostered by Xi Jinping's own approach to governance. Secondly, the risk to public safety stemming from this style of governance is linked to authoritarian rule, where the trust in power takes precedent over faith in scientific methods. China's zero-COVID measures rely more on administrative and control tactics than on scientific approaches. The belief that control is superior to everything else results in a peculiar and markedly different epidemic prevention strategy compared to the global norm. This strategy involves confining Chinese citizens, employing measures such as quarantine facilities and centralized camps. The fundamental issue lies in the lack of trust in scientific approaches. Despite China's existing capabilities in scientific epidemic prevention, Xi Jinping's authoritarian leadership places administrative efficiency at the forefront, creating a somewhat absurd situation. Thirdly, Xi Jinping's approach to governance creates a void in information. Faced with challenges or uncertainties, he tends to conceal rather than disclose. For instance, when confronted with the rising youth unemployment, he opts for non-disclosure rather than finding solutions. Similarly, during the 20th Party Congress, if GDP growth data doesn't present a positive picture, the solution is to withhold information until after the Congress. Xi Jinping's decision-making diverges significantly from conventional thinking, especially in matters of public safety. During the COVID-19 pandemic, vital information including infection numbers remained undisclosed for a year. Many Chinese citizens, not fearing the post-zero COVID era, simply seek updates on the pandemic's current status and any potential mutations. However, Chinese authorities claim the situation is resolved and discourage further inquiries. Faced with such ambiguity, citizens resort to speculation and rumors. With the recent emergence of mycoplasma pneumonia, people naturally harbor doubts about ongoing viruses in China, whether it's mycoplasma or another strain. In response to these uncertainties, the Chinese government strategy is information concealment and advising against inquiries. However, when citizens are prevented from seeking information and their children fall ill without access to proper treatment due to medication shortages, the information blackout becomes a serious threat to public health. Under Xi Jinping's rule, this practice of concealing information has become a routine tactic for the Chinese authorities to address challenging or complicated issues, simply keeping the public uninformed. This not only raises concerns among Chinese citizens, but also alarms the global community. Xi Jinping remains an enigma, and the scale of the issue, the duration of the pandemic, and the potential global impact are all unknown. Chinese society and international public opinion should exert pressure on Xi Jinping to fulfill his responsibility for the people's safety and the global public health. The Chinese Communist Party should adhere to its duty and promptly report all public health safety matters to the Chinese people and the world. Despite Xi Jinping consistently discussing safety issues, his actions contradict the safety of the people, revealing the inherent nature of a dictator. Thank you for watching. Please leave a comment and subscribe to my channel. Just click the subscribe button right here. I'll see you again shortly. Until then, be well.